Very, very welcome and very good evening to all of my colleagues today to be here in time, rather earlier also. We are happy really to attach you in our activities and our all the praises to the Almighty to introduce some of our colleagues successfully passed their AKT exam recently happened. Hopefully my voice is clear. Please, anyone can help me.
Yes, sir.
Okay, thank you very much. Thank you very much. So we are here today to exchange the views, and we will be very happy today if we get someone, our colleagues, those participated in AKT exam and successfully passed. And it is very, very congratulations to all of the colleagues from our heart. And we are delighted, grateful that you were attached with us. Side by side, we will be sorry and feelings our actually sharing our feelings, those who couldn't, but it is very usual in our post-graduation life. So we like to hear from them, and definitely we wish them best, and they will be again quite enough fit for the next OSCE exam. But today we will be in touch from them, and today as before it is not my session really, and I will be listener like all of you today, and hopefully we will be very grateful after hearing them, and some other colleague might be joining a little later. And in the meantime, personally we had chat and contact those who passed in the meantime, and some of them are busy, might be in their job, and others it is very real, so we may not have each and everyone today here, but those who are here, we will be glad to be with you and we like to listen from you. Uh, I don't like to mention that who actually passed and others, but we'll be very happy spontaneously if you feel to share your opinion, uh, your suggestion. Most of the time we are guiding, we are suggesting, but those who passed, you are the real warrior. And what is your experience? If you share with us, definitely it will be useful for our next colleagues in the next AKT exam. For this reason, we requested you to be with us today in these very exceptional sessions, and I'm very grateful who suggested us to arrange such a session. Really nice. So may I request Dr. Hind, please, can you be connected with us? You can open your mic, please, Dr. Hind.
Yeah, Assalamu alaikum.
Wa salam, Dr. Hind. Very nice to have you today with us. And so far I understand you are from Qatar now.
Yeah, I'm from Qatar, yeah.
Thank you very much. But I can remember some other Dr. Haynes. They are from maybe UAE or Saudi Arabia. Your name is similar. It's very renowned name to us in many activities, in many courses. So it is Alhamdulillah, all the praises to Almighty for your great success. And again, we like to share our great feelings to you. But today I told that the sessions for you, those who passed, we hope that some other colleague also will be joining with us. And I'm sorry I don't know all of your status today. Did you appear the exam and did you pass or not? Those I got personal message, only I know them about. So Dr. Hind, what I like to know, suppose if I will be appearing in the exam, so I like
Yeah.
to know something from you. What you have done and what others is to do in future. There might be some mixed experience in the exam, some technical points of view. And our colleagues, those who are listener today, our humble request, you can raise your voice also to ask Dr. Hind and other colleagues, those who will be talking today. And if possible, I will share with them as well with my experience in last many days. I am actually attached with all of you almost. So Dr. Hind, first of all, again, can you start with your talk, especially those will be waiting to hear from you. Please, Dr. Hind.
Thank you, Dr. Othman, for joining these classes today, and I hope to be helpful for other colleague. Actually, I'm prepared for this exam from last of November, and I'm studying from past medicine and other courses actually, but I didn't join for this course. I didn't hear about your course. I only in the last month before exam. So I joined for the courses and really enjoy with the last lectures. And after that, actually, I going for all this lecture already. It is in their your program and all your exam that there. So so actually, I'm really I find the benefit from this all this is exams and the recall exam and all that lectures. I didn't actually watch all the lectures, but I watch what I have needed and I have difficulty of this. So for everyone you want to prepare for the exam, so just I give him the advice. So you have to listening very well for the lectures, and after that you see what his difficulty and starting to study well with some difficulty, and you have to all the time to try to um, uh, solving a lot of exams in the past medicine or the recall exam or any exam we have it. This is the mainly you have the benefit from that more than study actually. So, and before that, for sure, the gut will help us for everything, and this is a plan from the gut to find Dr. Osman in the last month. I didn't nothing know about him before. So so really, I want to say thank you for helpful and thank you for everything you're doing for us. And really, I'm so appreciated for everything and for your calls. Actually, I didn't join your calls from the start, but I watched the video you have it, and it is very um um I find really it is very important, and it is very for especially for the last week before exam, because everyone at that time is very nervous. You don't know from where you have to start to study. So only actually I watched the recalls for all the exams, and I watched the lectures. So and all the I solved a lot of exams you have it there. So really, I want to say thank you, Dr. Asma, for everything.
Thank you, Doctor. Just can you be with us until the end? We will not be in very longer session today because I
Okay.
think our other colleague will be very excited to ask you something, and I am also to ask you something. But before that, I think chance for the participants today, if other colleague also who want to share, even anyone who passed in the meantime, can you open the mic, please? Any other colleague who passed a recent exam? If we gather the comments together, then we'll come in the feedback or other part. Otherwise, any colleague, please, you can open the mic and ask Dr. Hind what you like to know. It is very important session really to interact, because if you learn, if you read many things, but if you don't know the technical parts of the exam, so very difficult to pass. And those who appeared the exam and passed the exam, they are the real person to tell you that exam is so and so. And Dr. Hind tried her best to share with us. Please, anyone, open the mic, please, to ask something about the exam. Does it mean that you understood everything and nothing to hear more? Who will be asking? All of you busy? Sorry. I thought that you
Assalamualaikum, sir.
very good. Well, salam. Please, Dr. Nasser, welcome, doctor, please.
Yes, sir. Sir, uh, okay, now, actually, I want to know what is the pass score this time. This is 124. Somebody wrote here. The last exam, it was 135, very high.
Okay. The 24, the score you mean?
Yeah, passing score. Somebody wrote
Passing a
right
score.
now.
Oh, so what is your question?
Sir, this is one of the question, and other question.
No, first one by one we will try to solve. It is actually technical question though, that the score, if you want to ask that, the scoring actually is not simple score like previous old method manually calculating something. There might be some digital system. Nowadays, everywhere the scoring system is like this. Sometimes it is called scaled scoring or other this, and uh, and this technical thing better not to know really. It is don't think that score maybe 200 and from there it is 135 or 125. Sometime in almost all of the royal colleges in the world, they adopt a technique in the digital systeming is that suppose who score the maximum number, for example, sometimes they express the number, they score in the percentage. You know about the Dr. Nasir, please be connected when you are talking. Don't close the mic.
Yes,
It
sir.
is called the decile, centile. Have you heard it in the
Yes,
biostatistics? So
yes, sir. Yes, sir.
sometimes they decide in this
Percentile.
way, yeah, percentile. So sometimes they think that the who acquired the maximum score, that is 100%. Okay, and below, down, there are the different systems. So this scoring might be a digital systeming or even the manual, whatever. So 125, 135, 124 or 135 around, it is just a number for you to remember that in general for understanding minimum you need to achieve suppose 150 from 200 question. That means suppose if you appear our complete mock exam, you know that there are 200 questions. So
Yeah.
remember, without complicating the things are there, the just minimum 150 you need to achieve. You should have good answer or positive answer, correct answer. But accordingly, suppose if you say that the it is what how many it will be percentage, maybe 70 75%, right? If you say
Yeah.
150, correct. So like this, if it is above 80%, everywhere, even in MRCP, we have the experience of this also. When we were preparing, if 80% crossed, it is said as the green signal for you. So below 80, 80 to 60, above 60%, it is actually rather to say yellow signal. And below 60%, unfortunately, red signal like this. So these 124, 135 around, you understand now, above 60, is not it? 124 means above 60. Clear,
Yeah.
Dr. Nasir? So
Yes, sir.
above 60 will be in the yellow zone, rather to say. So up to this enough, doctor. No need to be busy with this number of other. It will encourage you when you appear the exam. If you can do minimum above 60%, you need to do something further. You need to try your best to score around 80%. For this scoring is okay. Yes, Dr. Nasser, any other thing you need to ask?
No, sir. Just waiting for the person who passed the exam
Yeah,
and share
yes.
their
No.
experiences.
Thank you, doctor. Thank you. Doctor,
Thank.
any other colleague to ask anything further? It is important, doctor, because we usually don't say it with this topic usually. Uh, but on request, we arrange this thing. Your time is valuable. Everybody's time is valuable. So other colleague to ask anything? No more. So Dr. Hind, please, can we interact now, please, Dr. Hind? Thank you,
Yeah, thank
doctor.
you.
Thank you. Just to ask you, you understand that in the exam, somebody asked me also, but it is not clear from the Royal College's instructions and others. Like in MRCP, you understand the MRCP, not I'm telling MRCGP. In the MRCP, in the part one, there are on an average, the allocation of the questions are clearly what I said declared that from the cardiovascular disease, there may be 14 or 13 question, respirology like this, so on. But
Mm.
actually in the AKT, we couldn't say and we didn't get. But on an average, uh, we calculated around 10 question almost from each system, especially to say the major system. What your experience? Is it like this?
Actually, Dr. Osman, I don't think will be like other exam. There is no, I think there is no percentage for every chapter. Yeah, actually, there is some chapter, there is more question. I hear it for the last exam. I think there is more question from pediatrics and rheumatology and dermatology. For this
Okay.
exam, actually, the medicine, it is not the top, actually. Um, there is, yeah, from the cardio, but it is not two more question. It could be, I think, less than 10 question from the cardio, from respiratory,
Yeah.
else
Yeah.
also. So there is no, actually, there is percentage for every question. So that's why I ask everyone, you have to cover everything, also the
Yes.
minors.
Yeah,
So
thank you, doctor. That's very nice addition from you because from the decades, that means 10, 12 years back, as we are
mm,
following them, the Royal Colleges, they are changing their pattern in understanding. And actually, personally, I was following them. And very interestingly, when I was a learner like you, when I had my learning materials, I actually preserved for future. All praises to Almighty that I am here with you now as a mentor, a simple mentor with you. Then I was thinking, in future, what can I do? For this reason, I was following all the activities. And at that time, it is said that the maximum 80% around topics will be covered from the internal medicine. And it was
yeah,
true. It was true because when we passed, actually, myself was preparing for the MRCP. MRCP, with this preparation, just added something from like pediatrics or surgery or orthopedics, a little, and that was enough. But recent few years, what you said, and I followed their Royal College activities also. What you said, the pediatrics, women's health, actually, sometime they're taking the lead in the topics because it is found that especially in the South Asian perspectives, our the child and the mothers are near about 50%. So we should cover it. And very interestingly, those who attended our last sessions regularly or even followed their online module, you understood that we actually given the emphasis on the pediatrics and the maternal health maximum. I think Dr. Nasser can say because he was following us throughout the classes all the time. Maybe 5 or 6 classes from women's health. In the pediatrics, around like this, 5 classes or 6 classes. But from the cardiology, not that much. Actually, we converted our design very recently. So, very happy to know from you that this is actually compatible with our strategy as well. Yes, Dr. Hind, the can you connect with us
yeah, I'm
again?
with you. Yeah.
Yeah. So in the exam, how many percentage of questions, for example, on an average, you have to or you had to answer blindly that
Mm-hmm.
you know nothing about, but definitely you answered it. And that
Mm-hmm.
was our technique and tips also we provided before that no question will be empty. So
Yeah.
what do you think?
Actually, Dr. Uthman, usually, we all, I think we know, the last question, 20 question, usually will be easy. For me, actually, I'm started from the first question, but actually, I'm paper exam. I'm not computer based. So I think
Okay.
there is a difficulty for paper exam because the time is will be very little for that. He
Yeah.
give you three box, one box for the question, one paper for the answer, and one box for the pictures and ECG and everything. So it is this will consuming a lot of time when you read the question and you will see where the picture and like this. So it's for me actually I find it is so difficult and taking a lot of time, not like computers.
Oh, I
Uh,
see.
but for that actually I'm training a lot of time to try to solve exam it in past medicine by timer. So I think this is one. It's one of the reason to help me. But still, in the first 100 question, I answer it very well. But in the last 100 question, I'm try to going very fast because I don't have time to thinking a lot with every question. So I'm
Yeah.
trying to every question I'm stay for at less than 1 minute, 50 seconds or something like this. And if
Yes.
I don't have the answer, at least what is giving in my head first thing I thinking about it, so I answer it. So I'm thinking I have time to go to revise again. Actually, I didn't have any time to revise any question. I finished the
Yeah.
last question with the last minute.
Very right,
So
Dr. Hind. I can remember also a little, though, many years before. This timing is very important. Sorry,
mm,
Dr. Hind, to pause
yeah,
you. I will come to you again.
yeah,
Especially the technical thing you highlighted very nicely. The last few 10, 20 questions usually remain as such that you need to answer very rapidly, even you don't have enough time to read also. So
yeah.
what we have done in our, yeah, Dr. Amena, we will come to you later. Keep waiting, doctor, and keep your hand raising. The thing is that uh, usually what you started, Dr. Heen, that the later the last questions are remaining easier. It is very fact. And I also remember the last maybe 190 up to 200 question or like this. These are relatively easy answer. But if you don't have time, you have to give blindly, rapidly, you have to finish, there is a chance. So every 1 minute, actually, you have to spend for one question from the beginning. Otherwise, you cannot reach. Keeping this in our mind, we designed our mock exam, those who appeared, you understand, if you give 57 question in each system, we are giving actually 57 minutes, not more than that. And in our course activities also, those who even saw our recorded classes also, you understood that we tried our best to lead our colleagues how to read the question, jumping manner, identifying the key words, not reading like this, each and every word, full stop, comma, like this. If you make a habit to read it, then you can save your time. So this is very important one thing. And another thing already I said you that you have to touch each and every question. Next point is technical part. Dr. Hind very nicely elaborated that the difference between paper exam, paper pencil exam with the digital or online exam. Yes, in the online exam, time in your hand. Doctor, anyone appeared by digital exam today? Can you share your experience, Doctor? Anyone, please, so that it will be easy to discuss together. I'm coming to Dr. Amena. Please don't worry. Just to finish this headline, the technical part, paper based and the online. To say anything. If anyone, then we could understand the difference between. But as experience in, I had the experiences. I appeared in many exam, MRCP, MRCGP. So the paper actually it takes some time. Dr. Amena, please, you can open the mic. Dr. Amena Muhammad, open the mic, please. But in the paper, you have to fill up the boxes with the pencil. Again, some time you have to erase these, definitely. So, Dr. Hind, why didn't you choose the online system? Is not available in your center? Or
Actually, no, you cannot choose for this. Actually, I sent the paper for very early, but I don't know why he gave me paper
paper
basic.
base, paper base.
Yeah,
Paper
yeah,
base, I think the technical thing is that they select some centers, online centers to accommodate the participants or candidates. There are some limited seats, no doubt. And
yeah.
in the last exam, you have the experience and others also. Some doctor couldn't get the seat also. And they are informed at the very 11th hour. I think a huge applicants are there. They are arranging the venues. So when the digital venues are finished, I think at that time they invited or they allocated for the paper base might be. Dr. Hind, thank you very much. Be connected with us. Dr. Amena, please now.
Yes, Assalamu alaikum,
Well,
my
salam,
dear
doctor.
colleagues and mentor. Good
Yeah,
evening.
good
I
evening,
really
doctor.
highly want to congratulate my colleagues, all the doctors who have passed. Actually, I'm very beginner and just started and thinking about MRCGP. And I'm very open and hoping that you guys will just give little bit of insight how to prepare and how was your preparation time, for how long you have studies, and most importantly, what was your study materials. Thank you.
You are asking me, doctor?
To the participants and as you, sir.
I will summarize, don't worry, that some those who attended our activities, they know, but any new, very interesting, I will tell you a little later. But before that, any other colleague want to share something, those who appeared, actually expecting from them?
Yes, sir.
Dr. Gayani, Dr. Daniel, or other also to say something. Dr.
I'm also
Daniel,
just
please.
yes. Assalamu alaikum.
Your voice not clear, doctor. Can you check your sound system?
Is it clear now?
A little improved, but until we are waiting to have it
Okay.
better.
Okay. So I'm also just a beginner. I'm preparing for MRCGP International South Asia from Pakistan,
Okay,
and currently I'm enrolled in 2 year structure training in
okay,
Pakistan.
okay.
So this is all about my introduction, and I'm listening to all of my colleagues those who have passed, and I want to congratulate all those who have successfully completed it. Thank you so much.
Thank you, doctor. But sorry to, I think I heard a little. Maybe there was problem of the audio. So, any other colleague to have some to say something? Otherwise, again, we are coming to Dr. Hind. Dr. Hind, please. Thanking you again. You are very happy to be with us today. And regarding the different parts of the preparation, as you mentioned also, to go through the recalls and others or mock exams. Actually, we designed many things in our module, and interestingly, you came to know about us very lately to say. And only reading is not enough. Suppose everybody following the past medicine. And we know about, and I know the history of our past medicine. And we were appearing or preparing ourselves. At the time, the past medicine was EMRCP, emrcp.com. The later on, they transformed and come to the past medicine. So I know their history, and it was very open, the learning materials for everyone in the world. Anyway, so it's very nice for the beginners. Did you go through other than past medicine as a
Uh,
reading
yeah,
material?
doctor. Actually, I told you I joining with other classes actually.
No, I'm
Before
asking
we
about
were
the
planning.
question bank. We already
Yeah,
provided the
question
past
bank.
medicine
Yeah,
in our module, no doubt.
question bank. Actually, yeah, there is. I going with there is one two books actually. One of this is. It is. I think it is the family medicine box. I do.
Could be,
MRCGP
could be,
family
could be,
medicine.
could be.
Yeah,
About
and
about the renowned one, doctor, past test on exam. There are some renowned author.
Bus test actually I'm trying to solve some question there, but I didn't actually finish it all.
Okay,
Just some actually a system. I'm go to the for cardio endocrine some system only. I'm
fine,
doing the bus test.
fine. So, Dr. Hain, regarding these about your thing, past, everybody is reading the past medicine, and we are also favoring it initially. Uh, One technical thing is important. Today, Dr. Amina and others also try to understand that if you gather many things, for example, question banks, past medicine, past test, on examination, and many others,
Mm,
it will increase your burden. I like to say burden. Why?
mm,
The concepts are same, right? Understanding a
right.
patient,
Yeah.
understanding a disease is very
Mm,
basic.
yeah.
If you understand the disease and the basic thing of investigation, basic things of the management, it is enough. So if you go through thousands questions, it will kill your time. So we
Yeah.
are very shaggy and reluctant to provide you, those who have seen our module. We are very, and even we have written in a question bank, those who used it remember that the, there are question bank 1 and question bank 2. And 2 we mentioned as optional. Optional means
Mm-hmm.
if you have time, then you go through. Because it is not that only you have done with question bundle, it will be enough. You have to proceed further. After reading something, you have to go for the mock exam. And even if you finish your reading bundle 100%, your score will not be 100%. It is very fact. So again, you have to refresh. You have to come back for your learning. For this reason, you have to calculate your time. If time allows, then if you say that your first priority is the past medicine, you finish the past medicine topic, and then again go to the optional. I will show you a little even in the last 1 or 2 minutes time as Dr. Amena requested. Then you have to recapitulate after system mock where is your gaps, and you need to discuss each other. For this reason, we open our WhatsApp group a little. The windows are open for you to interact, and we are giving some tips and tricks also in the here. So the learning material about that. But what we started is from the learning material, what information will be attracting for you to create this thing. We advise all of you colleagues to start to listen our discussion class. For this reason, we actually given the video lectures. Those who are using the module is a recorded one, but it is recorded means record of the live interactive classes. Those who attended before, From there, you just get your plan what you will do now after listening. Because suppose if we discuss diabetes, it's a very big chapter. How many things you need to learn from the diabetes, we cannot assume by self. But when we are talking about giving some examples of the question samples from the question bundles or from our experience, you will come to know that, okay, these are the things I need to learn from the diabetes after listening the lecture. Then go to your learning bundles. That is the past medicine and whatever else additional. Then you understand, okay, I gathered this thing. Then go for the system mock. We kept the system mock in the final part as well. There are two sets of the system mock. This will be the way. This is our structure, what I like to share with you. So, Dr. Hind, the second thing is that we provided some learning slides. I don't know,
Yeah.
have you seen it?
Actually, yeah,
We
I
told
see.
that
Yeah.
relevant slides.
Yeah.
In the relevant slides, okay, there are something which we discussed in the lecture classes or interactive discussion class. In addition, there are additional messages also.
Mm-hmm.
It will be actually helpful for other part one exam in the world as well, especially in the MRCP one, including the licensing exam in many countries. So if somebody sees it, it may think that it is more elaborated. But actually, what we like to share with you that the topics demands, you need to learn it from there. And all the informations are available in the books, in your PDF, in your
Mm-hmm.
even hard copies also, in the lectures, anywhere. But why we have done it, our idea, in the teaching methodology, fortunately, I have some experience. I am trained up also very recently in my country about the teaching methods. If the informations are presented in different ways, it will stimulate many neurons in our brain. By the point of neurolinguistics, it will be easy to grasp. For example, if we share the messages with a picture, this is the very best way, or the videos. So this is one of the another way to give some slides copy. It is not write directly many text within animated form or something. So in the picture, you are not getting animation, but there are short sentences, little words, like a notebooks. Actually, this is our idea. How did you enjoy it, Dr. Hind?
Actually, just I found one free lecture for you. One our friend actually he's sent it for us, and I listened for these lectures.
Okay.
So I like it too much. Actually, it's very systematic, and
Very thank
one
you,
of us.
Doctor. Yeah, we got some response from others also about the lecture. Again, I like to say maybe you are prepared from beforehand also. Only listening the lecture is not enough.
Yeah,
The
it's not enough.
learning slide, suppose running slide, you have to check there whenever you are doing something job in your period, your off time, half an hour, you can. And the technique is, suppose you don't have enough time to read the question bundle. Usually one question to read, you may need 5 minutes time, right? Including
Yeah.
discussion and other minimum 5 to 10 minutes also sometime. But if you look at the slides, we prepared maybe 5 or 6 slides. Those who are using the AKT group, nowadays you are seeing that in topic wise, we are giving the post of the slides. For example, cardiovascular related to the hypertension, we are providing almost all the slides. If you look at, you minimum will have an overall idea of the hypertension or heart failure like this. So these slides are important to
To
impress
have that
your brain.
guideline. Yeah.
Yes. But if you go through about the hypertension management investigation, maybe one day is not enough to finish, right?
You're right. Yeah, right.
For this reason, sometimes these things are there. So lecture, those who are listening as a beginner, very beginner today, the lecture followed by slides, then come to the system mock. And system mock actually collection from the past medicine and other related past test or the on exam, even some of my actually personal collections. And we modified according to the South Asian perspective also. And it is very learning issues in the appearing the mock exam and stimulating for the participants how much you need to know you will understand from these. So we discussed about the question bundle, learning slides, and the system mock and the complete mock as well. What other any interesting thing, Dr. Hind, you like to add from our learning materials? And other colleagues also, if anyone who are using or appearing exam, you can join with us, Dr. Hind, later after Dr. Hind. Please, Dr. Hind,
Yeah,
anything
yeah.
exceptional you observed from our
Yeah,
activities?
actually, Dr. Rahman, all the time I'm looking for your question posted in the WhatsApp groups, and do you solve it a lot of this question? So this is one of the way actually when you are busy in the hospital, when you're busy with the patient, something like this. So we have just 1 to 2 minutes. So I'm all the time I'm looking for this question. I'm trying to answer with myself. After that, I'm looking for the answer. So this is one of the reason actually it is very helpful, and it is very systematic to put your to remember this, because actually the family medicine is very huge topic. So all the time you will forget a lot of things. So the other thing I want to everyone to know, you have to know the guidelines for main topics. So this is the first thing. If you have to know it. For example, for treatment of hypertension, so we have to know for investigation what you have to do, and how can diagnose it, or how can we manage. So these guidelines and is put it in the slides in your groups or in the past medicine. So you have to keep this slide in your mind, and all the time try to revise this slide. So the
Yeah,
guidelines is very important, because
yeah,
the
yeah.
exam now is changed from the is not like English book like before. It is mainly is a clinical exam. So it is really it is neat. It's very short question, not this huge question like past medicine. It is very short question. So exactly he wanted from what to diagnose, what is the investigation, what is the next for investigation. So always you have to know what the next, what the investigation we need, what you think that, what the disease of this, what the medicine we needed for this management of this patient. So because now the exam is become clinical based, so the way of the study it will be different. For example, I will not write looking for definition of hypertension for the patient have to be like this and like this. No. So you have to thinking about if the patient coming for you, and if I have hypertension, what you thinking about if the patient is black, or the patient it is at least I'm 50 55 years or above the 55 years, what the first management we have to doing for him. So all the question actually will be like this.
Yeah, yeah,
So
doctor. Yeah, very nice. And that is the thing, doctor. We actually tried our best. Unfortunately, you couldn't attend the other all of our lectures, maybe
yeah,
for your time
absolutely.
constraint and others. And those who attended, you know that every time we are trying our best to explain the patient. When we show a scenario, that is we are showing a patient. We are not
Mhm.
telling or reading the text from the question bundle or any from anything else. So we are trying to tell you that, and even you can remember that we have given red marks. That is the what are the
Yes.
highlighted words are there. Those who appeared, you know it. From there, you have to choose it. What are the keywords? How to differentiate? And very right. Yeah, Dr. Nasir, I am coming to you. The very thing is that the what you said, this is the our life as a physician, as a clinician. What is the probable disease of the patient having now, and how I like to evaluate the patient further with the investigation and the management. And this is our real life. If you ask about definition of hypertension, even I can remember when I appeared one of the exam of Saudi Arabia many years before. The question was asked, what when insulin is invented, sorry, discovered, in the which year? That question was very, what I say, I like to say, very bad question as a quality. I didn't forget it. And it is written in our medicine book, I know, and possibly I was right to answer. But it is not a good question as a clinician. What is the invention or other is not important. but rather how insulin working, what are the complication of the insulin, that is important. Everything's are there, and in the question bank bundles, even in our discussion also, everywhere with this philosophy, what Dr. Hind said, we are following it everywhere. Dr. Nasser, please. Dr. Nasser, you raise the hand, please. Sorry. Try to connect with us in the
Yes, sir. Yes, sir.
connected.
Yes.
Yes, please, Dr.
Yeah.
Nasser.
Sir, better we have Dr. Ramiz here. He
Dr.
can
Ramiz here.
share his.
Sorry, where Dr.
Yes.
Ramiz, please.
I just saw him, and after.
Oh, thank you, Dr. Nasser. You are very vigilant. Dr.
Yeah,
Ramiz didn't respond, and I was asking. Dr. Ramiz, please, in
yeah,
addition,
I'm
we
sorry.
have,
I was
thank you.
just traveling there, so unfortunately I couldn't join time.
Now, can you keep 5 minutes with us, Dr. Ramiz, if you spare
Yeah, no
time?
problem, definitely.
Please,
Sure,
please.
sure, sure, sure.
We discussed many things really from Dr. Hind very nicely, but what exceptional thing you would like to share with us, Dr. Ramiz?
Yeah,
But
regarding
first of all, Dr. Ramiz, we like to congratulate you officially from the
thank
session
you so
Yes,
much.
today.
sir.
From the session
Dr.
today.
Ramiz, many congratulations.
And Dr. Ramesh was very
Thank
regular
you
in
so
our
much.
session.
Thank
I
you
can
so much.
remember, right? Yeah, Dr. Ramesh,
Thank
please.
you so much. Thank you
Yeah,
so much.
yeah,
And I would like to share my experience shortly. So, what I had is I have like busy schedule with my, works. Yeah. So during that schedule, I have been following your class somehow as much as possible and try to join lively.
yeah.
So I've been very careful about live session. Whatever the session, I was just listening and I was just trying to grab something. So that is very important. Whenever the lectures, even recording session is fine, but live sessions giving more rooms to get something from
Yeah,
you.
no doubt, no doubt.
Definitely. And the thing is that the question pattern and the answer patterns, whatever you are thinking, the mind, the way, that it will reflect in the questions. So the options, answers, whatever things discussing in the class, that is more than sufficient, more than enough. The time management, as you said always, time management is very important.
Yes,
Time management is you will get not 1 minute actually 45 seconds only. So the thing is that don't give priority to the long question or any difficult question. Just go ahead and complete 200 questions. That time
yes,
itself you will
yes,
get.
yes, very right.
Uh,
We discussed Dr. Ramesh before also. Maybe you are little late to join with us today. And always I was telling, and even today also told that the number of the question bank is not enough. The development of the concept is important. If you can develop your concept even with 2000 question, 3000 question, enough. But if you want to
yes,
read
yes,
5000, 6000, it will make you blind rather. Okay. The basic thing, Dr. Hind also noted that the how the patient presented with us, what are the key messages, and then what will be the investigation plan and what will be the management plan. These three things, the basic we have to identify from the scenario. Most of the question like this. For this reason,
yes,
if
sir.
you go through 10,000, 8,000 question, it will not give you actually enough idea to answer correctly. Dr. Ramesh, just to ask you, I think Dr. Hind also connected with us. Some colleague asked, I don't know why they're not asking by their voice. If possible, Doctor, someone asked about pass score. I'm reading here, short questions with the less key factors. Every question in the exam is with, sorry, if somebody can highlight it very clear, and there is a key factor to answer. Dr. Hind commented, yes, key factor to answer. How many months enough to prepare for exam? Time management. Dr. Ramis, how many months enough to prepare exam along with job? A very practical question. Dr. Rabbani asked, I don't know, Dr. Rabbani may not talk for any reason. Dr. Ramis, what do you think?
I think so. It's like 4 to 6 months.
4 to 6
Along with
months.
your job, 4 to 6
4 to
months.
6 months. And we recently we are facing this question from many colleagues that those who are very new. Recently we tried to understand what will be our answer. This is variable. Suppose what about your job? How many you are busy with you? And suppose in 24 hours you are busy with the 8 to 10 hours in the job, and what you are doing in the remaining time, it is also important. Are you busy with your family or other issues? So you are having less time. But main thing is that keep yourself in the study almost every day. You are not reading, but even then you are thinking something. So how it is possible? If you are the member of our AKT group, all of you understood that our AKT group actually will compel you to be attached in the study. Wherever you are going or open the WhatsApp and others, definitely something in front of you, you are giving some answers and thinking something. But if you remain silent, detached from the study at all for any reason, it will be very disgusting and devastating in your preparation. So 4 to 6 months is very minimum. I agree with you. Those who are having some background knowledge, but those who are very beginner, suppose you are detached a lot time from after graduation, you need to start from the beginning. It may take even 8 months to 12 months also. This is very practical. This is very practical. Do you think, Dr.
Yes, yes.
Ramesh?
Yes, I
Yes.
have some small academic background. That's why I thought four to
I,
six
I
months
understood.
mentioned.
It is for you.
Yeah,
I understood you.
yeah.
It is for you, but not for everyone. But minimum
Yes,
four to
definitely
six months.
you need because the questions they are asking with some basic management knowledge that you have to have from some sort of they're checking some core skills of your theory also. So
Yeah.
better to it's very hard without your coaching to do the exam. I felt so because when we see the questions, they are really different and the shortcut whatever things you are highlighting the points, red notes, red points, so those things are only clicking it, and we are not
Yes.
thinking other than those things. We are not minding at all. For a small example, for ethic question, as you're teaching always, some question will be same answers. So in that same answer, I mean, 5 question will be same answers, but you will tell some regarding some. For example, small example, child had, I mean, the child was with a 10-year-old girl. She was living with her grandparents or somewhere parents. The parent had some bruises. The child has come. Legally, what you will do? Like that, if they ask, so you will tell us like when the chance comes to us, usually choose the answer that should be unique. So that
Exactly.
point will be there.
Yes,
Yeah. So
exactly.
that when you go to regular class, you will understand what you are telling. That
Yeah.
you cannot gain from your simple thing. So that's why you're telling that background knowledge will be needed when you. It will come when you join this courses actually. This
That
course
is, that is the
actually.
very thing. There is not, rather to think that there is nothing prototype like question bank as it is question will come in the exam. Dr. Hind also mentioned this. And regarding the big size question, big size means sometime you need to read the big size question for your preparation. But in the exam, usually is a very short time exam. As you mentioned that you are getting less than 1 minute time. The authors understood it. The examiner understood it. So they are asking in very maybe 2 sentence or 3 sentence, not more than that. But to understand these sentences in the exam, sometime you need to learn a bigger scenarios. For this reason, it is not that we are discussing this thing sometime in our question or the discussion class. Even past medicine, past test somewhere, they are actually putting this bigger scenario for understanding only, not for the exam purpose. It is true. Thank you, Dr. Ramesh. We will knock you again. And someone raised the hand,
Thank you.
maybe Dr. Rita. Dr. Rita, please. Why you drop down your hand? Please, Dr. Rita, can you
Hello,
open?
sir.
Yeah, yeah, please.
Congratulations to who are cleared the exams, first of all. Actually, sir, my question is here, as now we are going for the November exams, na, right? Because I'm little bit worried about the how the questions are coming means nowadays.
How means,
Just
doctor, what you like to know about?
means last time as we are in very the question scenarios and like that very jumble and haphazardly sentences I like that na, so not cleared on that time in on last November. So I was asking that is the pattern is still same or this time the question is clear cut like that or means that my question is like that.
I think, may I take the chance to respond, Dr. Ramesh, on behalf of all of you?
Yes, yes.
The thing is
I
that,
have
please, Dr. Ramesh, please proceed.
uh, I have read your recalls, right? So from that recalls, almost 50 questions. I've been expected that questions like similar pattern, and sometimes it's similar answers. So you will get that really exposure with that recalls. You will have a good confidence, but you have to touch that recalls once you finish those all the chapters according to sir's guideline.
Yeah,
After that,
exactly.
only you have to touch the recalls.
Yeah,
Without,
but
if you directly first time, if you go and see the recalls, and you will don't make it more confident, because at last moment that recalls will help you a lot.
very right.
So
Very right, Doctor.
directly or indirectly, that question will reflect. So
Dr.
I
Ramesh,
have seen
I
that
have,
many
sorry,
questions. To
Dr.
be honest.
Ramesh, I am having very interesting comment to share with you now regarding the recall. What we took the recall classes, I found some other colleagues are very interested to listen the recall, but I was not very.
Because our James, because our James really
No, no, this is
at
okay.
last moment.
I agree with you that because recall I prepare by myself with my full intention and attention. But I actually don't like to encourage more to come to the recall only. What you said. Recalls are for
Yeah,
the 11th
definitely.
preparation, 11th hour preparation to listen the recalls and others because recalls are very theme questions. And possibly all those who attended the recalls, all of you enjoyed the recalls, no doubt. And I saw that many colleagues are waiting to attend our recall sessions. But thing is that recall what you said, this will be helpful only if you have the base in your mind. Otherwise, recall will give you a very false impression. Because in the recalls, we cannot
Yes,
discuss is the disease detail. We
Residential.
discuss around 150 recall in
yes,
one
yes.
session, right?
That,
Maybe divided into
that
two,
the
three
thing, sir.
classes.
That the thing.
That is the thing.
Yes.
So in the last time also, we took 3 classes. We separated the pictorials and others. And so if you only listen the recall, but there are some techniques. For example, very few candidates, they are having very less time. We provided them only the recall and the mock module just to guide them how to prepare themselves even within 2 months time. So suppose we have around maybe 10 or 12 recalls are there divided though in 50, 60, minimum 60 question in one recall. So it will take again maybe 10 means 10 days. And again, you have to appear the system mock, maybe 20 or 21 system mock. Again, you have to go through back to your learning materials back a little. So it will take minimum 6 to 8 weeks time. So at the 11th hour, you can. So always short route is dangerous, right? If you have the foot over bridge, if you don't cross by the foot over bridge, you are trying to cross the road by yourself, there is every chance of accident. So this is happening. For this reason, I agree, Dr. Rita and others also. If you say about the question pattern and other, you can have idea only by the recall class from the recall classes. And if you go through the question banks, near about the question bank, no doubt. But again, what you were thinking before, maybe your preparation was, I'm sorry to say that not up to the mark to understand the
Yes.
question. If
Yes, exactly,
already
sir.
you have gone through many months with us also, I hope that in future question will not be like before to you. I believe. I believe. And what we said before, try to identify the keywords. What we
Mm.
discussed with the red word, you can remember in the red color marking in almost all discussions. It is the important thing to identify the keywords. Then it will be easier for you. Right.
Yes. Thank you, sir.
Thank you very much. So anyone, Dr. Ramiz, any other thing or any question also? Any other extra
Yes,
comment?
sir. Yes, sir. The lessons like you are teaching that big questions, that is very helpful because you can understand the concept of the question. Sometime in endocrinology, it is little bit harder questions.
Yeah,
So,
yeah.
like when you understand that basic from big question only, you can do that exams. It initially we thought it will be little easier, but the harder knowledge of that big question only it will helpful for at last moment.
Thank you. Dr. Ramesh, just I like to add about the endocrinology. When we are taking the endocrinology classes, I can remember the endocrinology is a non-specific system. If we say the system of the whole body, sometimes endocrinology may be assumed as psychiatric disease also. For this reason, to pinpoint where is the disease is not easy like cardiology, respirology, or gastroenterology. And there are some metabolic issues are there. This is also under endocrinology. So we said that endocrinology and the metabolism. Even nutrition, some extraordinary topics also included in the metabolism. Keeping in this in mind, in the last module, Dr. Ramiz and other, you can remember that possibly we have taken 3 or 4 classes. The acid-base disorder may be relatively harder to say by somebody. So we took acid-base disorder as separate class. Again, we have taken about the nutrition and the basic endocrinology from different organ wise, maybe around 3 classes or maybe 3 classes we took from the endocrinology. Even then it might be harder. And again, I agree with you, without discussion, it is not easy. Suppose a chest pain, you can identify maybe disease in the heart or lungs, or at best in the esophagus of the GI tract. But in the endocrinology, weakness, dizziness, okay, whole body red or whole body pale, like this. Even it may confuse you with the hematology also, like this. So every system actually have its own peculiarities. What Dr. Ramesh discovered, very right. Again, we like to say, if you don't come into the discussion, it is very difficult to achieve it. Only by reading, really, it is difficult. Dr. Ramesh, to add anything?
And dermatology questions, that is dermatology. I mean, every question like dermatology is really satisfactory, and eye diseases, that subspecialties, whatever the questions, there, if you studied your theory or like whatever the questions, it will be really helpful on the exam time. So no need of go to beyond other past test and all. I never see any past test question or anything. I don't know even the past test question even. So,
Yeah.
but only studied those particular topics in whatever the way you taught, and the question, whatever the way you asked to follow. So it is enough, I think so. But
I
we have
agree.
to like.
Sorry, yeah, Dr. Ramesh, I strongly agree with you. And only one question bank is enough, right? So
Definitely,
if
sir.
you think that the past medicine, but again to say that only reading past medicine is not enough also. Do you understand? Actually, all of you understood what I mean. That means only reading past medicine, you are not going to the what I say discussion classes, you are not going to the mock exam and discussion, even you are not finally finishing your preparation by looking the what I say recall classes, it will not be enough. And very interestingly, in our module, we have given some master classes of ECG, chest, not chest X-ray, overall all X-ray, main highlighting chest X-ray, and other pictorials. And we actually prepared the pictorials basically for the MRCP before, how to identify the pictures. So we added this thing in the module. It is very interesting. We are always telling that a picture telling many things to us, but it is the you and myself to identify the messages from the picture. So if you understand the technical parts of the picture, it will be very easy not to see 1000 chest X-ray. If you understand technical thing and other thing around 50 chest X-ray, I think that is enough. So we divided the chest X-ray classes into 2 broad headline. As Dr. Ramesh said, that 4 to 6 months, like Dr. Ramesh, is enough. So at there only X-rays in AKT. This is one class. It is enough for like those who are a little advanced. Other thing, master class in the X-ray, rather to say that X-ray in the clinical practice. I can remember the headline. So those who are beginner, rather to say, you need to go through both the X-ray in the clinical practice, followed by X-ray in the AKT. So like 5 classes maybe from ECG, basic, then come back to the ECGs in AKT. So we divided this class in the module. In this way, you have to go through this. Anyway, uh, any other thing? One technical thing is here to know about the any family medicine training is important. Actually, it's a very technical question. Is maybe we need to give the answer. In the South Asians, there are very lack of organized family medicine training. Those who are seeing the patient in your locality, this is your family medicine. You need to just put it in a certificate, and then doctor, sorry, we cannot mention your name. Can you start this? Is written as Zoom. Please, doctor, welcome.
Hi,
Dr.
doctor.
Salsa. Hi, Dr.
Yeah.
Salsa, welcome. You're free little, huh? Thank you very much.
Yes,
Congratulations to you.
yes.
I'm very happy to see you. Any additional matter, technical thing already I discussed about, and Dr. Ramiz and Dr. Hind also contributed a lot of things today. And any extraordinary thing, Dr. Salsa? Officially, we like to congratulate again. It is our
Thank you
chance
so
and
much,
privilege.
sir.
Please carry
Thank
on.
you so much.
Yes.
Anyway, I have to thanks to you also to
It
that.
is.
Actually, doctor. Actually, the thing is, when we prepare for some exam, we have from multiple opinions. So someone will say, "Go for this, go do this, revise the past papers, everything." I was very fed up with everything. Then when one of my friend send you this one down, then I thought of, okay, I will give up all other things, will focus on yours class, everything. So Alhamdulillah, I cleared finally.
Very nice to have you,
So
Doctor. You told me you may be busy in the duty, even then you join with us.
yes,
If
yes. I'm
possible,
on duty
yeah,
actually.
yeah,
So I
yeah.
ask my patients to wait for 10
Oh,
minutes
thank you,
because of
Doctor. If
your time.
possible, few minutes, Doctor, just be with us. We are in the end of discussion today,
Okay.
and maybe few Arab colleagues are here, and I request Dr. Mona, possibly she is not here today. I told her to say something in her language. It is in Arabic. I don't know those who understand Arabic. Someone is to help us to explain. It is not very long. If you can hear, I am opening this, opening her opinion in Arabic here,
Okay.
just to listen and try to
السلام
translate.
عليكم.
Can you hear, Doctor?
أنا
Yes.
شخص في كورس دكتور عثمان غاني، وكان كورس مفيد جدا وشامل واستفدنا منه كثير، وأشجع الناس تشترك معه، خاصة التسجيلات حقة الريكولز. موجودة تسجيلات ريكولز، ممكن 10 ريكولز موجودة في الموقع.
Oh, I think Dr. Hind will be very nice to translate it today, if I am not wrong. Dr. Hind.
Yeah.
I understood that mumkin ashara recall. I little understand, maybe 10 recalls are there or something like that, she told.
She's speaking about your courses, and she recommended everyone about their course, and she's taken the benefit for I think she's passed the exam, right?
Yeah, she passed exam.
Yeah,
Yeah,
yeah.
she passed
Said
exam.
she joined from the early, and she's success with this courses, and she said actually about there is you have everyone to join for recall. There's about 10 recalls in this courses. So that's it. She didn't say anything.
Thank you very much, Doctor, for a good translation. And again, happy to be to have you, Dr. Hind, till now. You are busy also, maybe. For my Arab colleagues, I like to add some technical thing. Is Alhamdulillah that Dr. Hind is very nice in her English language and others, but some Arab colleagues have some difficulties. It's very practical to understand the language. You see that the exam system is on English language. So when actually we take the class, for example, start the discussion, and we have many colleagues throughout the world, especially South Asian countries and the Middle East countries, and a significant number of colleagues from the Sudan. Some are from, I don't know, maybe for your job purpose, you are working in the Qatar or Kuwait somewhere, in the Oman also. Even from my native countrymen are there. So I have to talk in as much as possible in very standard English language. Sometimes it might be difficult to understand. So our target was to prepare the module, what we are distributing, and we are already after the AKT exam, we updated a lot. And somebody requested to provide you the thing. We took few days. Those who are using, that few days in our hand to update it, revised it. And in the lectures are there. So the great advantage is to listen more and more. But if you attend the live classes, it is only for the one time, right? Class is over everything is over. So we are providing, actually we provided before also the records, those who attended as live. I remember Dr. Salsa is here today. Possibly Dr. Salsa couldn't attend all the lectures, right, Dr. Salsa? I remember you as much as possible.
Yes, sir. Actually, whenever, because of my duty shift, most of my
Yeah,
duties are evening
yeah,
3 to 11.
yeah,
But
yeah.
you know, the biggest advantage of whatever the lessons you are giving a proper recording. So whenever I'm free, I'm just keep on these open these recordings and I'm learning from that.
Yeah,
It's very
I remember. Yeah, I remember. For this reason also, especially I was talking about my beloved Arab colleagues. So you try to listen, because this is the scope. Until your subscription time is there, you can listen on and on. And it is in few years back also in the OSCE in future, inshallah, those who will appear OSCE Arab colleagues, you need to talk in English. If you cannot talk English relatively frequently or fluently, it will be difficult in your OSCE exam. If you think in between, your time will be gone. You will be given only total 10 minutes time. For this reason, if you listen more and more, definitely your English vocabulary will be improved, no doubt. By virtue, those who are Indian, Pakistanis and others, relatively they are a little fluent in English, no doubt. But those who are, I don't mind Dr. Hind, you are very nice in English, no doubt. But for other colleagues, I understood. And I know that they're trying too much. And somebody told also before that they are discussing each other in Arabic each other. I actually discourage it. I told them, even you talk with your spouse in the house in English, it will be useful for your exam, for your family issues and others. You were talking ish hada, shwaya, kullu, always. But better to say in English. Your language is the English the exam. So until you pass your exam minimum, try your best English language. This is my suggestion again. Please, anybody else to raise other thing? How many months we answered? Dr. Rita, understand, make your concepts okay. We already discussed about the recall also. In the recall, there are pictorial recall separately given. And we updated even the last recent recall also in the coming module. That means all the time we are arranging the recall sessions. This is already added in the new module, right? Any other colleague, please, to say something. Dr. Amena wanted to see maybe the module issues. Dr. Amena and other, can you see this, please, in the screen? The face of the module. Dr. Amena, please, can you be connected? Actually showing
Yes,
for
sir.
everybody. So this is actually seems to be a PDF. It is rather to say a dynamic PDF. We discussed before also, if you want or anybody want, we can provide the link, or you get it also from the group. How to utilize this dynamic module. If you click there, suppose in the YouTube, it is available. I'm just showing a few seconds only. In the
Okay, sir.
YouTube, the whole videos are there to utilize it. Utilize it. Materials we design. Step is this is just like this, Doctor. Answer is correct. You see in the green color, so it's navigating. So this is the contents are shown there, Doctor, everywhere. These are basic things, something about exams and others. I'm just scrolling down very rapidly. System-wise, everything's are there, and every system ended with the system mock. If you click there, mock will appear. So I'm not
Okay.
opening this to save the time. And in the right side, you see from the flow of the basic lecture, there is some master classes, X-ray in the clinical practice. In the cardiology, this is actually more regarding ECGs and many other things, including in the cardiology, you see ECG, dyslipidemia as a metabolic part. So it's like this. Every system went down, and in the last part, there is again the system mock. After miscellaneous, the system mock set 2, it is actually for the final preparation. Again, the system is repeated one by one, and then you will come to the recall. This is recall. You see, Dr. The Mona said Ashara recalls are there. So like this, maybe Ashara or more than that. Okay. 11 or 12 or more, and it is maybe added more also. For this, it may be more than 10 could be here. Recall 12 November, pictorials also 12 November. It will be added also more in future, no doubt. and the attempt complete mock and others. So the final mock will be there 200. Up to this, for Dr. Amena and others, those are very new. You can be with us, Doctor, later on. Personally, you can communicate. We will try your best to explain everything further if needed. So this is the thing, and we are at the end. Further one. This is the structure we design in the content of the recall in short. Sorry, the module in short. Actually, those who are new, they are asking when will your live session will start another. Actually, we finished our live session before. Those who attended, from my side, we like to say that we have given maximum possible effort to prepare the module so that you can learn anytime, anywhere. And we are connected with you in the WhatsApp at best, as much as possible, to give you some tips and others. So there are more than 75, and there will be more classes, inshallah, no doubt, because there are some basic things, especially some travel medicine, genomic medicine, directly not mentioned in your syllabus of the AKT, but it is important, no doubt, in elaborative manner, including some basic thing in the clinical medicine. We already plan. By the mercy of Almighty, we will invite you. And those who passed AKT and even didn't pass also, it will be useful for all of you. Even my undergraduate student also, we already prepared something. And there are some remaining topics of the emergency medicine. For example, you have taken one class emergency medicine, but there are some other topics. In a real life situation, we tried our best to include. So we have written more than 75, means there may be 80, 85, like that. It will be enriched and enriched in future. Basic discussion. Again, the recall will be added after each exam almost. And in the meantime, those who were using, I know that every week possibly we are improving the relevant slides tagged with the each lecture discussion, compatible with the MRCP also. It will be very useful. So this is the in short. And further, in addition, though we are talking about the AKT today, those who are appearing in the MRCP and others also, we have some similar modules. So this is the final thing, Doctor, from our side. And again, gratitude to Dr. Hind, Dr. Salsa, Dr. Ramiz, Dr. Mona as well. She shared her comment. Even any colleague to raise any voice today now? The session is open for you now, Doctor. We are near the end today. And I don't know any colleague today. Is everybody attached with us in the group, Doctor, in the WhatsApp? Otherwise, I am trying to give you the link in the chat box for everybody. You can join. You can join if possible now. Okay. The WhatsApp, and these are our YouTube. If you are interested, you can see the YouTube videos also. So any interesting comment, Doctor, you like to share? You can share with us. Otherwise, we like to finish today. And very really and happy to have those who passed and you have given your input. We invite you, those who passed, to already possibly you have joined our OSCE groups. It is also improved now, and you will enjoy with us. And in the OSCE also there is a basic module. Please send your request to us to have the OSCE module as a trial version. You can see it. You can see it.